Good morning. This is Faith in Our Hometown, brought to you as a community service and sponsored by Mercy Hospital, Joplin. And now, here's your host, Father Jay Friedel.
Good morning, everyone, and welcome to Faith in Our Hometown. Thanks for joining us today. It's another great Sunday, and it's great to have you with us this morning as we talk about something that's going to be that we're going to have to go to the ballot box and decide how it is we want to do things moving forward here in the state of Missouri. Of course, this week is an election day, and of course, you'll always hear from me that it is one of the great blessings that we have to exercise our right to vote in this country. So we're hoping you're going to go out and to do that and to make your choices and your will known at the ballot box. It's very, very important. It's a great blessing we have, but also a great responsibility. So one of the issues on the ballot is going to be whether or not we're going to expand Medicaid for the state of Missouri. And what are the effects of doing that, and what are the pros and the cons? And so I've got a guest here this morning that's going to talk with us a little bit about that. Now, he's in favor of, but this is about informing everybody, and we are going to talk about the Medicaid expansion or the possibility of it right after this Mercy Minute. So don't go away. We're going to be right back with someone to talk with us, John Hicks, who's going to talk with us about Medicaid expansion or not.
Hi, I'm Karen Brown. Last year, my sister was diagnosed with ovarian stage 3C cancer in her early 40s. As a mother of two beautiful children, I didn't think twice about undergoing genetic testing here at Mercy. Even though I have grandparents and an uncle battle cancer, seeing a genetic counselor wasn't something that ever crossed my mind until my sister's results showed that she was BRCA2 positive.
We've come a long way, especially in about the last 5 years. Genetic testing can pinpoint the cancers that you are at highest risk for in order to detect them earlier or, if possible, prevent them.
My genetic counselor at Mercy, Robin, took note of my family health history and answered all of my questions. She even suggested my brother get tested. Robin said if he tested positive, he may be more likely to be diagnosed with pancreatic cancer, and that is what I lost my uncle to.
There are many other types of cancer that are also possibly hereditary, such as colorectal cancers, pancreatic cancers.
I honestly was prepared to hear that I was positive, but indeed I was negative. And what a huge relief that was, not only to me, but to my family, to know I wasn't at a great risk of developing breast or ovarian cancer.
Diet, lifestyle choices such as smoking or drinking all contribute to our risk for cancer. Genetic testing is taking just kind of one piece of that. Talk to your primary care doctor or your OBGYN and ask for a referral to a genetic counselor.
Well, again, we thank you for joining us for another Sunday morning of Faith in Our Hometown. My guest this morning is John Hicks, who's been volunteering with the group called Medicaid for All. Right?
Yes. Missouri Healthcare for All was the original group collecting the signatures and the petitions. It's now Yes on to Healthcare for Missouri.
Okay, well, there you go. So, John, tell us a little bit about you and a little bit about the group.
Well, the group primarily was formed for the purpose of expanding Medicaid in Missouri, which is Amendment 2, which will be on the ballot in the August primary. I began volunteering at the early outset, collecting signatures, because I believe that it's something that is sorely needed. I like to focus on the benefits that I think the people of Missouri will derive from it, which is 230,000 more people covered, people not having to decide, do I want to get health care? Do I want to buy some groceries? People not being forced into those unpleasant and awkward choices that usually result in healthcare losing out. Also, I think it's important to know that when we talk about expanding Medicaid, a lot of people, myself, but probably you, people watching this program, we're already paying for a lot of that, because when people who are not covered by Medicaid become seriously ill, and they go to the Mercy ER, Mercy's not going to put them in the parking lot. They're going to treat them. Now, they have no way to really recover that. With an expansion of Medicaid, seeing literally, that 230,000 people probably does not take into effect all of the people who lost their health care due to the COVID-19 pandemic. So it's probably a closer to 300,000 number. So those people go to the ER, They're still going to need services. They're going to be treated. The hospital has no way to recover this. So this eventually gets rolled into costs, gets rolled into insurance premiums, and things like that. So somewhere down the line, either the hospital, as many of our rural hospitals unfortunately found out, they're simply going to wind up having to close their doors, or the larger hospitals are going to have to find a way to either absorb those costs or somehow to pass them on to others. So from a purely economic standpoint, it makes good sense because it allows people who need coverage to have it. It also reimburses providers. That's why the Missouri Hospital Association, the AMA, the Nurses Association, these have all endorsed Medicaid expansion because they see the positive benefits for them. The Missouri Chamber of Commerce likes the program because in the first year it has the potential to create 16,000 new jobs because more money for preventive care, for maintenance care, things like that, allow some of these rural hospitals to restaff in positions that they've had to eliminate,
crunches,
and
sure.
reopen some of those, and there are residual jobs through that. So there are I saw a lot of benefit, but to be quite honest, I've seen a lot of people in Southwest Missouri who need health care, who need these benefits. And Missouri has a very, very low threshold for Medicaid. And by simply adopting Medicaid expansion, raising it to 133% of the federal poverty level, you can see how many Missourians are included. Last year alone, 100,000 children in Missouri lost their Medicaid. That's 100,000 children. And most of them found out about it when their mom took them to the pediatrician for their checkup or for their well care, and they said, "We're sorry, but you're not covered anymore. You'll either have to pay the $175 or we won't be able to see you today." That's terrifying to a mother. Right. You can imagine taking a small child to the doctor and finding out, no. And children, it's a fact of life, children get sick. Perfectly healthy children get sick and get hurt.
And that's why, and that's one of the reasons why we're so tense right now about what's going to happen when we start school again. Because
sure.
I mean, because kids spread, they trade all that stuff around. I mean, it's like it's just like and we're foolish to think that that suddenly we're going to be able to keep them all 100% hermetically sealed.
Yeah, you can't put them in individual bubbles.
Yeah.
So, and the other thing is a lot of school workers, people, non-teachers, in the school, custodial staff, cafeteria workers, office workers, those people, they're all exposed. And in a lot of particularly rural districts, some of those people may be considered part-time and they may or may not have health care.
Right.
So it becomes even more critical in the time of a pandemic that you provide access to as many people as you can. One thing before I do lose the thought on this, I wanted to point out, a lot of people, the first question you get from a lot of folks is, well, who's going to pay for that? We're already paying for it. The money is being taken from you. You are paying the taxes. Those taxes money are being sent to Washington, D.C., and they are being spread among states that have expanded Medicaid. So if you're okay with your tax dollars going to Washington, D.C. and being spent to help children in Ohio, well, that's great, but wouldn't you really like to help some children and some senior citizens and people in Missouri? The revenue coming back from the federal government to Missouri to support Medicaid expansion, the round number is $1 billion per year. So it's not something that we're going to take $1 billion out of the state budget. We're going to get that money. That money's been going there for the last nearly decade. So we've paid in a lot of money and we haven't got anything back. It's time to bring that money back.
So in terms of that, what would be the downside of doing this? And what have you heard from the other side? Okay, because we know you're in favor.
Sure.
What would be the downside?
I think there Really, I've heard several misguided, comments. People saying, well, in the long run, what if the government doesn't send us that money? What if they decide to stop doing that? They're obligated to do that by law if you participate in the program. That was kind of early on. The theory was, it's Missouri, okay? They don't really trust the folks in Washington, D.C. Now, we don't know if they're going to send us that money. They're going to send you that money. That money is guaranteed to you under this program. If you expand Medicaid within the guidelines, you will get that return. So I think that the apprehension about depending on them to honor their word, but they've done it in nearly 3 dozen other states. So I think if you ask the 35 other states that have Medicaid expansion, they're going to say, no, they're sending their money to us. We're getting the participation. So I think that's a little bit of apprehension, and some people are a little, I don't know about expanding a program. I think if they really look at it and they think about it, nearly everyone knows someone who will benefit from Medicaid expansion.
Yeah. So who are those people primarily that will benefit from the expansion?
Children, senior citizens, single mothers, low-income workers. A lot of people, even in this area, there are a lot of people who work. We're not necessarily talking about someone who's disabled or unable to work. People work. They have jobs, 40-hour-a-week jobs. Some of them have a 40-hour-a-week job and a part-time job. But they do not make enough money to afford conventional health care in the private market, but they make too much money to qualify for Medicaid under the current guidelines. Right now in the state of Missouri, if you worked 80 hours a month at minimum wage, you would make too much money for Medicaid. So if you have a single mom working a job with a child, and and this seems to be a popular number in this area, a $10 an hour job, that's $400 a week before taxes. She's not going to have the kind of money that it takes to buy health care. I can tell you health care premiums in Missouri are not going down on the private side. So a lot of what, I don't like to use the word, but I will in this case, because I think it's an unattractive connotation, but working poor. The people who are out there every day trying to make a living, trying to take care of their family, but they do not have the ability to generate a large enough income to afford health care in our current system. Those people will benefit from this. There are senior citizens who will benefit from it. There will literally be over 100,000 children who will once again benefit from it, who were fully eligible under the old program and for no fault of their own just got dropped from the program. So it's really people in need. If you've got a good job, with private health care through your employer or something like that, you're fortunate. Yeah. I don't think we realize how fortunate we are sometimes to have that. Now, if you lost that job due to the pandemic and you were trying to replace it, you may find that the new job doesn't come with health care, may not come with the same salary, and how are you going to provide? What happens if you do get sick?
Yeah, I know that certainly the Missouri bishops have come out saying, that there are things they want to watch and make sure, but for the most part they're in favor of it for those reasons, many of those reasons you just said. But again, this is one of the ways for us to try to pick up some of the people that have been falling through the cracks, and there have been lots of people falling through the cracks for a long time.
They have, and it is, from the standpoint of the church even, Father, it is a crime that in a country as wealthy and as successful as America, that we have so many people who they're either have no health care or they're one serious illness away from bankruptcy.
Yeah. My guest this morning, John Hicks, for Missouri Healthcare for All, and we're going to be right back after a quick break, so don't go away.
You're watching Faith in Our Hometown on KSN TV, brought to you as a community service and sponsored by Mercy Hospital, Joplin.
My guest this morning, John Hicks from Missouri Healthcare for All. John, we were talking a little bit before the break about the fact that, you know, in a society like ours, it seems amazing that there are so many people who are falling through the cracks. You know, there's so many people who are working 40 hours a week but still can't make it on minimum wage, and who may not have health care for their kids. I can give you one story. Back when I was a pastor in Piedmont, I knew one person who she basically had to quit her job so that her kid could receive the right medical treatment. She was working, but she was making too much money. Mm-hmm. Well, you know, again, what can we do for somebody in that category? And this would be one of those things that we could, you know, right, if we were going to do that.
Exactly. That's, as I mentioned earlier, the threshold in Missouri is extremely low. You know, this bill will raise it to 133% of the federal poverty level, which is not a lot of money, but it is a significant increase over what we're currently at in Missouri. And like that lady, and that is not an uncommon story, one that's been repeated many, many times around the state. But think of the effect that it has on this person. You know, she has a job, you know, she's doing what she's trying to be a productive member of society, but what's her first and most important duty? She's a mother. She must care for that child, and the only way to do that is to give up being productive. That's not a good system. That disincentivizes people in a very, very bad way. If she had that job and we had Medicaid expansion and she was able to secure health care for her child and continue working, this is a much better outcome all the way around.
Right. Well, I would think that it's what some of the people, I mean, those are some of the good old-fashioned values of our area. Mm-hmm. You know, and many of them I think are very good. You know, it's just like, well, everybody's got to pitch in and do their part, and, you know, what's fair is fair. I mean, I get some of that, and I agree with some of it, you know.
Yeah, it is, and in reality, this is very much the same way. This is helping folks who need help. And one thing, too, is, you mentioned Piedmont, which is, I'm not familiar with it, I'm assuming it's a fairly small area.
Yeah, it's out in the middle of it's out in the middle of southern part of the central part of the state.
So,
yeah. Mm-hmm.
But, you know, in these...
Wayne County.
In these smaller rural areas like that, or like in Pulaski County or somewhere, these people right now are having to go, in many cases, an hour and a half or 2 hours one way to receive medical treatment because they've lost their rural hospitals. Rural hospitals have closed at an alarming rate. One of the reasons for that is because they're not able to get the money. As I spoke earlier about people, you know, the costs in the emergency room and treatment, you know, if you went to, you know, Piedmont, to a small rural hospital in that area, you know, they probably, especially over there, depending on the income level there, they may not have a large number of private insurance patients. And in an absence of a more robust Medicaid program, they kept seeing more and more red ink until they were forced to close, because hospitals are, when all said and done, still a business. And this would give them an opportunity to revitalize the ones that are still out there fighting the good fight for the citizens. It would also potentially give some of those that had recently closed perhaps enough of an incentive to consider reopening, so that people who need some basic services don't have to drive from Piedmont to Cape Girardeau or Springfield or somewhere like that. You think about in our area here, you know, I mean, we don't think anything about, no, you know, go to McDonald County. You know, it's 35, 40 miles. Well, you think about if you lived in southern Berry County, for example, and your only access to modern health care was Springfield, you know. And it's like that in northern and southeastern and other parts of Missouri. So by expanding Medicaid and allowing more people to have access to coverage, we're able to see potentially that these regional hospitals that are on the cusp can survive. We can strengthen the ones that are kind of holding their own, and we can service the people. Also, a lot of these are jobs in that area as well. nursing staff, technicians. That's the Missouri Chamber of Commerce is a wonderful organization, but not necessarily a humanitarian organization.
They've got a human side, but yes, I will agree.
I mean, they're a business organization.
They're a business organization,
and they looked at this and said, "This is good for Missouri's economy. This will help the economy of rural Missouri. Will help the economy of urban Missouri. This will be a benefit to all Missourians economically in the first year and in subsequent years." So, I believe we have some pretty sound economic principles. We have some strong humanitarian principles. And if I might be permitted a very brief political anecdote, John Kasich, former governor of Ohio, former congressman, was asked during a 2016 presidential debate, "You're a conservative Republican governor of Ohio, but your state expanded Medicaid. How do you justify that?" And he said, "Because there'll come a day when I stand in front of God, and He's not going to ask me what I did if I did nothing to improve the lives of children and senior citizens in my state." So from a humanitarian standpoint, it's the right thing to do. It makes sense all across the board. It makes sense economically. It makes sense from a social and humanitarian perspective. It also makes good sense medically, because these patients who have access to this care, who are able to receive preventative treatment or treatment at an earlier stage, are less likely to develop a more serious condition requiring either hospitalization or more expensive treatment later on. So medically, by making them available to be covered, catching issues early and treating them there, you're avoiding, that longer. And because, for example, many children, but not just children, senior citizens, or many average adults have conditions in Missouri where if it was treated and caught in the early stages in the first year or two, then it becomes a manageable health condition. If it's left untreated in 5 or 7 years, now it becomes a hospitalization or a disabling illness, or even in some cases a terminal illness.
Right.
So I think all the way around, on balance, medically, humanitarian, economic, I think we do. I honestly, obviously, I'm a proponent of it. You had asked, what do people see as the downside? I think other than just the general distrust that people in Missouri are, it's Missouri, you got to show me.
Yeah.
So I think once they approve Medicaid expansion and we show them what it does, then they're gonna be, yes, we're glad we did this. It is on the ballot for the Missouri primary. It is amendment number 2, and a vote to expand Medicaid is yes on 2. There will be a lot more propaganda there will be a lot more information as we get closer to the election. We're going to
air, this show's airing right the weekend before the election, so yeah.
Great. I encourage people who have questions the easiest way is to go online, yes on 2, Healthcare for Missouri. You can there's question and answer sheets, fact sheets. If you like numbers and dollars, they're there. If you just have questions, they're there. We're going to be out in the community, trying to engage people as much as you can in a social distancing pandemic kind of way to get the word out. This is a marvelous vehicle.
Well, and I think that you raise a very important point here, John, and that is that if you don't know what it's about, that's why we're doing the show this morning, is to tell you what the issue on the ballot's going to be.
Yes.
Or certainly you've gotten this side of things. We mentioned a few things about the other thing. I know that, like I say, the Catholic Church of Missouri is kind of supporting it because, again, we see more benefits than there could be some things. Now, can people of goodwill disagree with us? Obviously, they can.
Certainly.
But especially if you don't know what's on the issue, what's at issue, and what's at stake here, That's why you should seek out that information. You got a couple days left before the election. So, you know, look up yes on to or no on to or whatever, you know, people against, and you'll hear the arguments from both sides. And I think that that's very important in terms of us forming our own, you know, mindset before we go to the polls.
Right, and if you are inclined to look, you'll find listings of, we're now right at, I believe, right at or just over 350 different organizations that are endorsing it, including the bishops, AARP, the AMA, you know, a variety. It's across the spectrum. Business groups, healthcare professionals, religious organizations. It's a true coalition. This is a Missouri issue. This is a bipartisan, humanitarian issue about giving more Missourians access to health care, helping Missouri to become healthier, and also a little bit it's creating jobs, and it's also getting back some of our money. As I say, we're already paying the taxes. The money's taken out of our check. It's not, but we're just not seeing it. So again, you know, it's nice that the senior citizens and children of Ohio got Medicaid, but I'd like to see some people in Taney County have Medicaid.
Sure.
You know.
Yeah.
So, yeah.
My guest this morning, John Hicks from Missouri Healthcare for All. We've been talking about the ballot initiative for this upcoming Tuesday's election. And we're going to be right back to wrap up after this Mercy Minute. So stay with us.
A new baby changes the world and each of us. The Sisters of Mercy devoted themselves to offering exceptional maternity and delivery care, training generations of nurses to do the same. Mercy continues to answer the same call, to not only care for your baby, but to cherish them too. Mercy, in every era, your life is our life's work. Learn why we serve at mercy.net/legacy. In Ireland, the first Sisters of Mercy were called the Walking Sisters because every day they went out in search of women and children who needed healing or help. Mercy continues to answer the same call, dedicated to the health of every woman who comes to us for care. Mercy, in every era, your life is our life's work. Learn why we serve at mercy.net/legacy.
Well, full disclosure after watching that commercial, you know that Mercy is our sponsor, and of course, Mercy would certainly be in favor of this, but I believe most of the folks at Freeman would be too, because it's just one of those things here in a community like ours. Anybody that works in the medical community knows that there's a lot of people falling through the cracks. This is one way of going up, perhaps fixing that. Maybe you don't think it's the right way, maybe you don't think it's the best way. And again, you've got to figure that out for yourself, because you're the one that has to go to that ballot box on Tuesday and decide how you're going to vote on this particular issue. I just hope that you'll get informed, that you'll form your conscience in a way that you can live with, and that you take care of the common good that we have to care for each other in trying to figure out how we can help some of the people that are falling through the cracks. So please be sure you go out and vote on Tuesday, and God bless you. Have a great week, and we'll see you next week at Faith in Our Hometown.
Thanks for watching. Faith in Our Hometown can be seen Sunday mornings at 6:30 and 9 a.m. on KSN. Brought to you as a community service and sponsored by Mercy Hospital, Joplin.